This video minute is sponsored by UMB Bank, your KDA endorsed solution for practice finance. Visit the KDA website to learn more. I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Wednesday, March 10th. Well, today marks the first day of the second phase of the Kansas legislature. Up to this point, bills that were introduced in the House or Senate were being worked, and those bills had to be passed by either their House. A House bill had to be passed by the House, or a Senate bill by the Senate. That's their House of origin. So those bills that have been passed now move on to the second phase here. There are bills that are exempt, and they can continue to be worked throughout the legislative session. And then the bills that were not worked and not in exempt committees are dead at this point. So as far as the Kansas Dental Association, of course, dental therapy was not worked, or dental therapy wasn't worked. It is now dead, even though it did have a hearing. We did have a couple bills, unfortunately, that we weren't able to get up for hearings, and those were our bill regarding orthodontic services and our bill regarding insurance. We thought we were going to get that orthodontic bill moved into a different committee that would make it exempt and keep it alive. However, kind of at the 11th hour, that fell through. So those bills are now dead. There certainly are some health issues that we continue to monitor, like telehealth. Telemed is a bill that has not passed yet, but it is exempt, so the legislature continues to work that. And then there's a couple different bills that have to do with professional licensure, requiring licensure or certainly some sort of accreditation across state lines. So we're continuing to monitor those and to make sure that obviously the interests of dentistry is fulfilled in those cases. Another issue of interest has been, of course, the ability of dentists and dental hygienists to provide vaccines. The executive order came out back at the end of February. We've been kind of waiting to get some news on that, and we finally have some more information. So a dentist or a dental hygienist can provide vaccines. That's generally was intended to allow those professionals to maybe volunteer at a clinic or a health clinic in your area to help provide some relief to those workers that are doing that, maybe expand hours or expand that ability. So if you're interested in providing vaccines or your dental hygienist in your office, I would urge you to contact your local health department or your local clinic that might be doing that. Now, there is a way for a dental practice to provide vaccines themselves, and that is to apply through the KDA vaccination program. You need to apply with that program in order to get approved and certified, and then from that point you could provide those shots in your office. So those are the two things we're looking at. There's the executive order also required training. So at this point, we don't have anything new on training, so we'll pass that along as we get that. But again, the executive order that was passed by the governor, or signed by the governor at the end of February, allows dentists and dental hygienists to provide COVID-19 vaccines, obviously FDA-approved COVID-19 vaccines. So if you're interested in doing that, please look into that with your local health departments and your local area hospital clinics and whoever else might be providing those services. We do have some upcoming events and activities with the Kansas Dental Association. First of all, I want to mention the Western Regional Dental Experience. That is the joint CE opportunity that we have with the Arizona Dental Association. That will be a virtual CE experience on April 9th and 10th. Those CE sessions on the 9th and 10th will be live, and then after that you can access those recorded. So if you'd like to get registered for that, I encourage you to do that. You can do that through our website and help get your CE as you go into the end of this year. Back on February 26th, the KDA had its Board of Trustees meeting. We had a great participation, had 22 people on the line of the 25 trustees across the state and all your districts that participated in that. So we've been able to stay focused doing those virtual Board of Trustee meetings, and that's really helped kind of keep things on track. So as we move into our General Assembly that we have, That's our KDA Annual Meeting. That will be on Thursday evening, April 29th. It'll be at 6 p.m., another virtual opportunity. We're having that in the evening so it doesn't interfere with your work, and that hopefully you'll be able to participate in that and participate in the KDA Annual Meeting. Now, we moved that off of the original date, which was Friday, April 16th, due to the cancellation, or at least of the cancellation of the live portion of the Midwest Dental Conference, which is still continuing in a virtual format. Well, as we finish up, I certainly want to encourage everyone to pay your 2021 dues. Most of you already have. However, there's always a few that kind of trickle in a little bit later, so if you haven't done that, please make that happen. You can go online and pay your dues. You can certainly call the Kansas Dental Association office. If you can't find an invoice or your statement that you received earlier this year, let us know. We can make that available to you, and you can get that done. So again, thank you for your ongoing support of the Kansas Dental Association. And with that, I'm going to wrap this session of the KDA Video Minute.